Anyone who is struggling with infertility will tell you that every time you meet in church and you're asking, hey, na mbona hauzai? Kwani umegojea nini? That word crushes. It's like stabs you.
Actually, it's good you mentioned that.
Yes.
A friend of mine, again in church, najua kanisani we are all holy.
Yes, very holy.
Anaenda kanisani and then one of her friends comes and said, utaanza kutapika lini?
Ouch.
Utaanza kutapika lini? Hii tumbo itabeba mtoto siku gani? And then you see that lady just looked at her and kept quiet. What this lady who is asking did not know, of course, not everybody knew, was that huyu ambaye anaulizwa had actually had a miscarriage the week before. And here is somebody saying, utaanza kutapika lini?
Yeah.
You know, very, very insensitive.
Yes.
So glad you could find time to join us yet again on the Reproductive Health Conversations here on Shared Moments with Justus. Once again, I'm glad to be joined by Caro, your health coach, and Dr. Kireki Omanwa. By now, of course, you know so much about them, but there's no harm repeating. For those who are joining for the first time, these have been the resource persons. I mean, you guys have shared not just experiences, but information that has impacted lives in a big way. The kind of feedback that we have been receiving for the last few episodes that we have run is overwhelming, but a blessing when you look at it, because we are finally having a conversation on things that affect our everyday life. So karibuni sana.
Asante.
How is it, Caro?
So far so good. Actually didn't know that this was so needed. I knew it was needed, but I didn't know it was that needed. And I'm glad to hear a lot of feedback. And it seems like we opened a door that I pray to God that He'll give us the grace to keep walking through, because this is a very sober conversation. I think these conversations are out there, but they are never like sober, or rather they are not factual, they are not real, they are not structured.
Yeah.
And so it's in whispers, but this platform has really made it's okay, let's have a conversation. And I still say it is such an honor to sit next to Daktari. It is such an honor because he makes it so easy for me and for everyone to understand.
I think he's redefining kazi ya daktari.
Kabisa.
Because
I actually didn't know a doctor would laugh and would have fun like this. And so it's also fun. Honestly. You know, tumewazoea mkiwa serious, but you have really redefined
Koti nyeupe, and you look at sura ya kazi
na ukiuliza maswali mingi unaambiwa anaandika na mwandishi
bila kuangalia, without looking at you.
Yes, so having this conversation of sexual and reproductive health, I remember, maybe I can share this. I remember when we were launching these shows, I invited a friend of mine, and then later he told me, "Ay, Caro, unaniita kwa conversations are sexual and reproductive." And then he watched one of the shows, like, oh, that is what you guys are doing. That's sober. That's good. That's really nice. So it's, for me, it's an honor, and I'm happy that God has chosen me to sit here and create this awareness.
Wow. And, you know, last there was an episode we did on masturbation.
Yes.
I think it's one of the episodes that we have received a lot of feedback, just to paint a picture of, you know, the gravity of the problem, of the issue at hand. And some of these concerns, we might not necessarily have answers to everything, but the fact that, you know, people are reaching out in itself, I think it's a good thing, Daktari.
I think this is a fantastic thing. I think, first of all, just starting these conversations, because as Caro said, these are some of the things, these are some of the discussions, topics which people talk, you know, in very quiet ways. They don't want other people to hear we are discussing about this. Apana, it's very, very personal.
Especially when you are Christian.
Especially when you are Christians. Unajua Wakristo wafanyagi hizi vitu. They never happen, you know, amongst Christians.
Yeah.
But I think, having said that, it is a good opportunity. It's a good platform that we are talking about these things, and also that there is feedback that is coming back.
Yeah.
And the feedback has been fantastic, as you said. There people are saying this is something that we've been looking forward to. So we hope that we'll continue, raising these issues, those issues which are sticky, issues which are stigmatized, and so on, issues which we are not supposed to be talking about, and so on. So I think it is opening up this space, and it is a safe space where people can ask questions, and they can be sure that the questions will be answered in a very objective way without any judgment.
Correct.
Yeah.
And it's interesting to even see now our viewers saying, oh yeah, I identify with this. Oh yeah, like they are no longer afraid of letting even their faces known that I'm following. That's a story that I'm identifying with. There's an episode we did, and we talked about a gentleman from South Africa, and he wrote back and said, yes, thank you for sharing that. I identified, and we could engage. So thank you as well for the platform.
Thank you.
Yeah.
And sometimes people think they are alone. When I know that whatever I'm going through is actually something that is not unique to me.
Absolutely.
It gives me hope to actually reach out and find a solution towards it. So today we are talking about infertility. I know it's a very broad subject, but it's one that we've received also a lot of questions and concerns around as it pertains to women, both women and men. But on this particular episode, we'll narrow down to how it affects women. But later on, we'll also look at men, the men's side of things. Okay. Yeah. But before we go into it, I want to read some feedback here. And I think we'll have to dedicate a whole episode on just responding to feedback and questions that are coming through. So this one says, hello Justus, watched the show on breaking free from masturbation. So apart from deciding mentally that one is going to stop the habit, doing a physical exercise, avoiding the triggers and replacing it with more positive engaging tasks, is there any medicine? He says because weeks ago he got conned 10,000 shillings. Someone promised to send him a drug but ended up losing the cash. And he says, to be honest, as I talk, my wife walked out of marriage for lack of sexual satisfaction. And he says he's willing to do anything that will help him sort the mess. And he says this has been going on since 2017.
So those are almost 7 years.
Yeah.
7 years.
What do you make of this?
First of all, I think there's quite a lot of desperation out there. And when you're desperate, you can fall into any arms. So there are people who will tell you all these things. I think from where I'm seated, I also got quite a number of people visit my office asking for the medicine to stop masturbation. And I think during our show, we and I'm glad he has highlighted everything we talked about. From where I'm seated, I don't have a physical, like a solution, a medicine that I can give you, because it's a whole process as we talked about, unless Dr. shares if there's any.
We don't have a medication
there's
per
no
se
tablet,
of,
yes.
of curing masturbation or even curing any addiction, because masturbation is an addiction. So it's a process in itself. So Paul Esana, for that gentleman who lost 10K, 10K is a lot of money.
Lost money, and the wife is...
And the wife has decided to walk away. So again, I think the most important thing here is that he has accepted he has a problem, because that is usually the starting point. I have a problem, I need help. Once we get to that point, it is a lot easier to actually help him to get a therapist who can actually walk him through the process, and hopefully he can stop this, what he has been practicing. And I hope that the wife comes back after that. And they start.
In fact, there's something he says right after that I think also is encouraging. He says, kama pia hakuna dawa, ni bora nijue, so that I seek psychosocial support.
That's what he needs.
You know, like,
Yeah.
this
That's
is
what
someone
he's-
who is really open to
Yes.
finding
to all the solutions. Yes, and I think from the experiences that they share, that someone shares when they come to your office, they are willing to pay any price to sort out that mess, as he has called it, a mess. So when you're getting into the masturbation, you don't really think the intensity until you get to that position. Until I'm sure that man can pay any price to recover from it.
It's very good the gentleman has come out and said that. I'm sure there are also ladies who are also in a similar predicament, who are also, practicing that. The other time when we were talking, I remembered I got a patient who came to see me, and she told me that her husband, her partner, was actually living in the US. That time it didn't occur to me. But when you mentioned it the last time, it's when now something triggered, the back of my mind. So when I asked, how often do you have intercourse? He said, we have it twice a week. And then in my mind, I was like, how do you have it twice a week and your partner is in the US now? So when you mentioned that there are these things, you go into a hotel and you book and whatever, you call it phone sex. It is when actually it occurred to me that there was something like that. So essentially it's just masturbation, only put in a very nice package, phone sex or whatever it is. So it is a problem for both the genders. It's not only men. The ladies are more discreet, I think, but they also have the same problem.
Yes, they have. And I think in my office, what I've experienced from the show is more women have come out. We didn't know the intensity of the women, but the women have come out either by default, because in my office when you come you'll find more women. Maybe they were finding it easier to talk to the women. I don't know, but it was also an eye opener for me to know that women are also suffering from it. Yeah,
this is a show on
itself.
I know. But we're really grateful for that kind of feedback, which really opens our eyes to a lot of things and makes these conversations really have the substance that they should have. And keep those questions coming. If you have any other concern or questions that you'd like us to be able to address, even in our subsequent episodes, let us know in the comments section or any other way, email. Even if you want to visit, come and, check out what Carol here is doing and the solutions that she is offering. And of course, Daktari, you can also visit his clinic, 5th Ngong Avenue.
Third floor. 314.
314.
Correct.
Right. So let's get into our conversation for today. And we are talking about such a huge, huge subject of infertility. We will try to break it down even more in our other episodes. But today, we'll try and see how much we can be able to tackle when we're talking about infertility in women. Where do I start? Let me start by reading something. Last year, June, this man told me if I don't get pregnant, I will have to leave. He used to ask me, how do women get pregnant? Na mi namwambia sijui. So simply put, she could just respond, I have no idea. I shared this sometime last year. That June 2023, I had some job training far away, so I left. The training was 6 months. During the time I was there, he kept telling me that I'm embarrassing him, namwaibisha, because I'm barren, that he will go find another woman who will heal him with her fertility.
Okay.
Who will heal him?
Who will heal him?
The man.
Heal the man with her fertility.
Okay.
She was with him for about 4 years, she says. Previously, I was married to another. We had stayed together 10 years without ever getting pregnant. That's why this guy thought I'm the one with a problem.
So man number 1, 10 years?
Yes.
No baby?
No child.
Man number 2?
Man number 2, 4 years.
Ndio anasema siku tuleta hapo kunichimbia vitu.
Yes. It does not end there. It gets even interesting here. Yes. So she says, now recently, I was involved with someone else. And guess what? Involved, of course, you know what that means.
Number 3.
So
man number 3.
Okay.
I couldn't believe that I actually got pregnant
Wow.
with a guy I was with for a very short time. Apparently, he insisted that I abort because he is not ready.
This man number 3.
This man number 3.
So should he say hallelujah? She got pregnant after 14
And now
years.
this one
And
wants
now
child, this one
wants-
doesn't want.
This
Yes.
one wants an
Okay.
abortion.
Yes. And then she says it's as a by the way that she's 40 years.
Ashikilie mimba. Ashikilie hiyo mimba kabisa.
There's quite a lot going on here.
Wow. Whoa.
What? So, man number 1, 10 years. Man number 2, 4
4
years.
years.
Man number 3, we don't
A
know.
few minutes
but
and,
is
A few
maybe
minutes.
maybe a few minutes. A few minutes.
And baby
And
comes,
pap.
boom.
But is hit jackpot?
and then, and then he doesn't want the
And then he,
jackpot.
he doesn't want. And then God is brought into the picture.
Yeah.
Yeah.
God is
God-
brought
that
into
God
the picture.
will work out.
Yeah. And there's the age factor.
And then there's the age factor. So quite a bit there.
Wow.
Quite
I
a bit.
actually can start with a question. I've had this myth that
Yeah.
I did not consider. There are specific men you can give birth with.
What do you mean specific men?
Yeah, there's that story.
Which ones
That
are these?
you-
I mean,
Maybe this one.
That you are infertile to some men.
Men, yes,
infertile
to some men.
What do you
Infertile to some.
mean?
I've heard that story, so I just need now. I'm actually putting myself in her shoes, and I'm thinking. So, what was the problem with the 10 years, with the 4 years, and then this one, boom? So, what was the problem?
Because sometimes
yes.
I believe what is happening here, and we don't have all the details.
Yes.
But there is an assumed infertility here.
4 years.
And the assumption is always, by the way,
woman.
it is always the woman.
Yes.
Why
yes.
is it always the woman? Because the woman, mnajua nyie ndio mnabeba mimba.
Yes.
All the difficult work that goes on behind closed doors,
the
whatever
women.
it is, the manifestation of that work or the fruits of that work is basically
Visible through the woman.
women. So if you don't manifest what has been going on behind closed doors,
You assume
the
you are
one who is the
everyone assumes you are the problem.
and a priori it's well known that wanaume mbele inakuwaga sawa.
Well,
We never have problems. we never.
Yeah, there's that, but there's that. Yeah, true.
Wanaume tuko sawa, so the problem
And that is why
always
it is even very hard. Women tell me how they go through a very hard time convincing the man, let's go for a checkup.
that is true.
Because how do I go for a checkup and I'm okay?
Yeah.
Unasikia mpaka huyo wa kwanza, huyo the second, I think, was it the second or the first one saying, you are embarrassing me because you're barren.
Yes. I actually had a patient some time ago, and she came and her story was tragic. I've had several patients, unfortunately, who have had serious and very horrible histories. I remember one that comes to mind. She had been married 4 times. She was on the 5th marriage now. And the first one, and all of them very long periods of time. The first one I think was 8 years. She could not have a baby. There was gender-based violence. She left, went to the second one, stayed there for I think 10 years, the same thing. Third one, 4 years, the same thing. Went to the fourth one. This one was the shortest. I think it was 2 years. The same thing. Now she had gone back to her lover who was in college. Now, miaka imeendelea. Now she was up, I think, about almost late 40s or even early 50s. And of course, the first ex, the very first one in college, of course, he was married, he had children, but there's still that flame which was still burning, So they went back to each other, and he was willing to actually try and have a baby with her. And of course, miaka imeendelea kidogo, so it was an issue of what do we do with her. Of course, suggested that she should consider using donor eggs, and of course use the sperm of the ex-lover, such that we can be able to help her to have a baby.
Yes.
She never came back. But coming back to the issues of infertility, obviously what that lady wrote about is a big problem in society. And it is a problem, it's not a new problem, it's a problem which has always been there. And you see, when God created Adam and Eve, he told them, do what? Be fruitful and multiply. So when the husband asks him, he says, kwani wanawake wanapata mimba namna gani? I don't know what he was expecting. Was he expecting cross pollination? Ile pepo inapiga, like flowers. I mean, he's been working. They have been working towards it for 4 years, and it hasn't happened. So the fact that for the first husband 10 years, the second one 4 years, that is basically what we call primary infertility. Yes. And primary infertility is basically whereby there is a couple is in a relationship. We don't want to know what type of relationship, but the couple here, we have to be very clear that it's a man and a woman. Yes. And they have intercourse on a regular basis. How many times? 2 to 3 times in a week. And what time has elapsed? 1 year has elapsed, and nothing has happened. There is no pregnancy. So we call that primary infertility. However, there is a small caveat that comes with that. It says if a woman is over 35 years and above, that period is shortened to 6 months. We'll come to that maybe later on. Yeah. So that is primary infertility. Then there is secondary infertility.
May I ask a question on the primary infertility? So if this 1 year there was a miscarriage or there was any form of the pregnancy, the one that is an empty sac or something?
Yes, an empty sac.
So is that primary infertility?
That comes to secondary infertility now. Yeah. Because now secondary infertility, of course, the same, sort of parameters are still there, that you've been having intercourse for 1 year, but there has been a pregnancy or you have a baby or children or babies for that matter. Now you're trying to get another one. And 1 year has elapsed and nothing has happened. This having a pregnancy says you had a pregnancy. It doesn't tell us whether that pregnancy ended up in a baby or, you had a miscarriage in between. And then the other thing in secondary infertility is that says that the woman is not breastfeeding on a regular basis, because breastfeeding in itself can actually act as a contraception. It can stop.
Okay, that's interesting. The conversation is, so when the woman is not breastfeeding consistently,
yes,
and they don't get pregnant, that is secondary infertility.
It's secondary infertility.
Okay, interesting.
If you're breastfeeding consistently, like you say, every 3 hours or so, when the baby wants to breastfeed, there is a hormone called prolactin, which is poured down. And the hormone prolactin actually tells the breast to produce milk. And that hormone actually works backwards and blocks the mechanism of getting pregnant.
Now, wale wanakwambia they got pregnant when they were breastfeeding.
It actually does happen. Yeah. It actually does happen, even though it is not very often. However, when they tell you that mimi nilipata nilikuwa nanyonyesha, it is because most of the time there's a time when it was not very consistent. It's just like some of the ladies who take contraceptive pills. They said, I used to take and then I still got pregnant. But there is a time somewhere something did not go well.
And that is, thank you for clearing that, because there are women who cry and say, oh, I got pregnant when I was breastfeeding, the doctor lied to me. But yet, as you say now, I see there are some who are not consistent.
They are not consistent. Yes, they are not consistent.
Okay, that makes sense.
I think we need to have another discussion about contraception.
Yes.
So on secondary infertile, I had a hysterectomy. I removed my uterus.
Correct.
So am I secondary infertile?
Well, are you trying to have a baby?
Oh, no.
No.
Okay.
That's another thing altogether. Because in fertility, you are actually
in relation to.
You are you are trying to have a baby. You are having this, intercourse, sex. You are having sex
with a purpose
2 to 3 times a week. And you see, when you have, the more you have it, the higher the chances. Okay. So if you are not trying to have sex, then of course you are not infertile.
Okay.
Yeah. Secondary infertile.
Do you feel better?
Much better. Much better. But that tells me that for a woman who've gone through hysterectomy, they need to accept that happened, and because there are those who are still struggling and they are wishing they had babies.
Yes.
I think we just need to come to terms.
But that will be a different group altogether, because now these ones, they need to be helped.
Yeah.
Because if you don't have a womb, and of course you can't carry a baby, then somebody else has to carry that baby for you. That is surrogacy.
Okay.
Which will,
So back to our story.
Yes.
The fact that this woman stayed here for 10 years.
Yes.
And, there were a lot of assumptions going on. I'm imagining, because of what is happening in the third relationship, perhaps there are things that were not investigated in the first relationship that ended up, more or less.
And even in the second
the
relationship.
Even in
one,
the
yeah.
second one.
In the second
you know.
relationship.
And you see, it's a strain on the woman, like we said. And it's not just a strain on the woman, but on the relationship in general.
Absolutely.
Exactly.
So where everyone is assuming that
She's the one who's the problem. Yeah. Meanwhile, there are other issues. So actually, I think that is where we have this issue, because infertility affects women, it affects men.
Yes.
Sometimes it affects both,
Yes.
and sometimes we actually don't know where there is a problem.
Yes.
So when it comes to numbers, actually more men are affected by infertility than women. Yes. More men are actually affected by infertility. Lakini kwa sababu tunasemanga mbele iko sawa, we don't go to be checked. And like that one, she was in 2 relationships, and I'm sure after the first one, the man on the side must have had another one.
Tried here and there, yeah.
Because I've had numerous cases when patients come to me, couples who are married, and then when you take the history, when you ask the man, so do you have a child or children? At the end of it, anaangalia chini, alafu anasema yes. Wangapi? Wawili. He feels embarrassed, but so when you look at the time frame they've been trying to have a baby, 9 years or 10 years or whatever it is, and then you find that he has 2 children somewhere within that time frame. Meaning, in as much as they were trying to have a baby with his wife, he was still trying outside.
So even men go through secondary infertility?
Men go through secondary infertility
and
as well.
They need to know that.
Men go through secondary, because the fact that today you have your sperm quality is okay does not mean that tomorrow or 5 years down the road or 10 years down the road, things are going to be exactly.
Yeah, because I recently had a client, a couple, and they came to me. The man says, which is true, he got 2 babies when he was in college.
Yes.
Now they got married when the lady had a child.
Yeah.
Now after they met 12 years down the line, they still don't have a child of their own.
Wow, a long time. To sit and wait. 12 years is a long time.
And there are so many other things in between.
So many other things can come in between. So coming back to infertility, the numbers are not good at all.
Yeah.
And it's good that lady actually came out and said, I've been trying, and I tried number 1, number 2, sasa number 3 nikabahatika. Maybe it was 10 minutes, or even less, by the way.
Yeah. Maybe it was not even serious.
Maybe it was not even serious. Yeah. And she got pregnant. When you look at the statistics, approximately in Kenya, approximately 15 to 20% of the population of Kenya is actually has a problem with infertility. So
20%.
About 20%. So if we remove the children and the teens and the preteens who are actually not included here, and we take the normal ones who are in the reproductive period. So if we were to say that Kenya's population is about 50 million, let's work with 50 million. So to toy 50% is 25 million, the children and so on. So we are left with 25 million. So 25 million, 10% of 25 million is 2.5. I'll have another 10%, about 5 million. Yeah. So even if we were to say it's 3 million, it is still a huge number. A huge number. You remember wakati wa COVID, how we were saying, today so many people, so now, I don't know, 300,000 have been infected, whatever. We should actually be having an update.
We made a big deal out of it.
We should be making an update. By today, 2.5 million Kenyans are affected with infertility. Such that we sort of, put this issue, we give this issue the gravity that it actually.
And I'm noticing that it's not just Kenya.
It's not just Kenya. It's not just Kenya.
I mean, you get calls left, right, and center from Juba. I think I was even trying. I've been working on doing a research on does the geographical area affect the infertility. There are some geographical areas you find that.
I'm not very sure about that, but there is something that is called the infertility belt. And the infertility belt starts from somewhere around Mozambique, comes all the way to Angola, crosses over into Zambia, goes over into Tanzania, even crosses over even to West Africa. And some of these countries in this infertility belt, actually infertility rates are about 30%, which is a paradox because in Africa we have the highest birth rates, and then we also have the highest infertility rates, which is paradoxical.
The few who are shooting,
they are just moving. They are repaying for these people who are not giving.
Right away, there's an issue of testing.
Yes.
That comes to my mind when I look at this case.
Yes.
That if this woman took her time to actually find out what was going on medically, perhaps there are things that would have been taken care of early enough.
Not only the woman, both of them.
Both of them,
right? Both of them. With husband number one and with now husband number two, the watchman. So both of them should have actually have had some testing, and these are some of the things that we look at. Maybe I'll take the last sentence that she said. And by the way, I'm 40. I'm 40. So some of the reasons for infertility here, age is a very big factor. Na vile alisema kwamba yuko 40, women as opposed to men, when women are born, when girls are born, they are born with a fixed number of eggs.
Yes.
So by the time you start having your periods, that number is about approximately 500,000 eggs. So every time a woman has a period, she actually loses, it has been approximated, anywhere between 800 to 1,000 eggs. So remember, you have a finite number. So that number keeps on decreasing every month. So if you start having a period at around 12, 13, 14, and every month you lose, let's use 1,000 eggs. So in a year, you lose about 12,000 eggs. So by the time you get to 30 years, that will be 12,000 times 30, you lose quite a number of eggs. So that is why we say around 35, suddenly the fertility rate starts dropping. It gets more difficult to get pregnant the older we become. We're talking here about getting pregnant for the first time, because we know that our grandmothers, sometimes even our mothers, they got married and they got pregnant even until their 40s or even their late 40s. So when you're getting pregnant for the first time, age becomes a very, very big factor. And the issue is because the number is dropping, the number of eggs is dropping.
Does that explain why women are chasing a golden egg? They keep saying that.
You can actually say that.
Golden
you can
egg.
actually say that here.
Maybe after 40, you will hear women saying, hey, I'm chasing after my golden egg, the one that is ready for fertilization. And, they are always chasing after it. But most of them don't even understand the concept. And I think that's the explanation.
Yeah. And then the other thing is that the older we become biologically, we start aging, our skin starts sagging, it becomes dry, and so on and so forth. So the same thing happens to the what you call the genetic material, which is in the eggs. So the older the genetic material, the more difficult it is to get pregnant. And then if this woman does get pregnant, there are very high chances that she will end up having miscarriages. And if the pregnancy does progress, there are very high chances of this baby having what you call chromosomal problems. So that is why most of the time you find children born to older women, they will have what is called Down syndrome.
Sometimes some of these challenges bring about other psychosocial, and it's not just a medical problem. And it's a burden that women have, unfortunately, to walk around with.
Of course, the socio-cultural issue that affects the woman as a person also affects the relationship that she has with the man. Because I think the biggest pressure first comes from a mother-in-law. Immediately after a while, they are already checking, and aunties are being sent to come and say hi and to check if you're doing something. I think the most recent case that I've had in my office is when a mother brought the son.
Kwanza hiyo ni makosa.
Yes. The mother brought the
just
son.
a minute. Just a minute. This is a grown-up son.
Yes.
Analetwa na mama yake.
Yes.
Kwa nini?
We were that lost. You see the way you are confused. That is how confused we were. And the mother comes and says,
yes,
I need help for my son because he has erectile dysfunction.
Na najuaje mama, honestly.
That was the question. And then after
dear.
you push and you pull and you realize it's the daughter-in-law who've told the mother, and the mother has felt it. It is my responsibility. Let me carry my son, take him.
A grown up.
Yes, a grown man.
Who is married.
So this man,
analetwa na mama.
hata ukimpatia dawa gani, his ego has been crushed to death.
Absolutely.
To death.
Absolutely.
So even if you try and treat it, so that is it is not medical. There is the medical aspect, but then the way you have handled it has crushed the remaining part of it. And that is how our ladies or even our young men, first of all, no parent is willing to accept it is their son that is not able to raise, to give birth. Because every parent thinks my son is macho, is good. So no, especially the mothers, the first reaction, the first instinct is it's the girl who has a problem. Especially if by any chance, by bad luck, maybe she didn't even like you from the word go, you are done. You are done. You are done. So the first instinct, when the woman feels like I give birth, so why are you not giving birth? What is it that you're not doing? I've had cases of women even taking some special food, giving the daughter-in-law, telling her, please give my son, they have a language. Women have a language. So it affects the esteem of the girl. She's already hating herself, feeling not good enough, wondering what is my problem. And unfortunately for a woman, when she's not able to bring forth a child, she starts looking for all the faults. She will even think it's because my hair is black. She'll look for anything to blame. And that is human nature. When something is not working, you will always look for something or someone to blame. And now it makes it worse if, for example, she's experiencing what we shared during our very first episode of low libido. Because how will the libido be up when I am feeling not good enough? Unfortunately, if maybe you have not a man who is not supportive, that is also another problem. You are trying to convince him, let's go to daktari. There is no... I've actually seen couples who come and say, I've taken her to all the hospitals. I've done everything I can for her. And you ask him, and have you taken the test? And he's not willing to do that. He's not willing to go that. I've seen a very worst case of women who have had depression and other serious mental health issues, some committing even suicide because they feel segregated. And unfortunately, sometimes even our own biological mothers will not understand. They'll keep asking. And there's a question that anyone who is struggling with infertility will tell you, that every time you meet in church and you're asking, na mbona hauzai, kwani umegojea nini? That word crushes. It's like stabs you.
Actually, it's good you mentioned that.
Yes.
A friend of mine, again in church, najua kanisani we are all holy.
Yes, very holy.
Anaenda kanisani, and then one of her friends comes and says, utaanza kutapika lini?
Ouch.
Utaanza kutapika lini? Hii tumbo itabeba mtoto siku gani? And then you see that lady just looked at her and kept quiet. What this lady who is asking did not know, of course, not everybody knew, was that huyu ambaye anaulizwa had actually had a miscarriage the week before. And here is somebody saying, utaanza kutapika lini? You know, very, very insensitive. Very insensitive.
And unfortunately, infertility is surrounded by a lot of unkindness, a lot of misunderstanding, a lot of feeling superiority complex because I have a child, I'm better than you.
Yes.
So I'll keep looking at you like this. So even sisters and sisters-in-law are looking at you. Kwani, what are you doing?
Kwani, what kind of woman is this?
Even social gatherings.
Yes, social gatherings, you are secluded. There's a couple that told me they no longer go for social gatherings at all. Because then they're supporting each other as a couple, but the rest of the world is against them. Yet they are really trying to do everything and anything. The saddest bit I've seen is when now they are struggling and they've already gone to daktari, maybe they've tried IVF, or they're trying this and this and this. And then the husband, because he's embarrassed, he tells the lady, do not share this with anyone. So she's dying by herself inside. She should not share with her mom, neither her sister. So some of them have come to my office and I told them, it's okay, this is a safe space, tell me. And she'll cry and tell me, imagine he has not even allowed me to share this with anyone. And he's not even allowing me to share with him. So you've put her in a box. That literally you have put that girl, you've put that lady in a box where she will always be stressed. And that is, I suspect that the viewer who has just shared, she can share more details on how much depressed she has been. 10 plus 4, 14 years is not a joke.
And
14.
you know, Dr. You might actually end up believing that you have a problem that you actually don't have by, that
And
kind
even
of
cause the problem
environment
to
and
come.
cause the problem. Because even psychologically, mentally,
it will
stress.
Yes,
the
it will
stress.
cause
The stress will actually cause infertility, even though we don't know, we cannot quantify how much stress is needed, to lead to infertility. But it's a well-established factor that some couples who have struggled for a very long time, and then either miraculously they get a baby, or they go through other processes and they have a baby, and then after some time, bang, they get another baby, just like that. Why? Because that pressure, societal pressure, family pressure, is already not there.
Even this one, the fact that this pregnancy came in an unconventional
way.
means when she was
Just,
busy,
I'm
not
like,
really,
okay, fine.
she was actually not looking for.
Yes, when you stop looking, actually, you've reminded me of a couple that had no child for 12 years, and then all of a sudden now she has 4. She's like, Carol, okay, now this is enough. Now, I don't know how to handle this. Now they are becoming too much. Do I stop? And I'm like, you've been praying for it.
And God has given you, has blessed you, has opened your womb.
So she has even stopped her job, and now she's busy taking care of the children. So as you say, maybe when you relax and the pressure is reduces, the seeds just decide.
But again, that is in cases whereby we have done all the tests and we sort of don't seem to see where the problem is. Because some of the issues with infertility, we talked about age, we haven't talked about blocked tubes, which is a big problem. About 80 to 85% of the clients that I see actually have issues with blocked tubes. Can be one of them which is blocked, both of them are blocked, they have fluid in one of them or both of them, and so on.
And now I saw someone asking, I think on our YouTube, I don't know, I can't remember, asking, can you conceive when you only have one tube?
The chances are reduced drastically by 50% because it's only one side which is working. So you have to time, if there is anything, you have to time such that when you're ovulating from that side which is okay. And of course, this sometimes you may have it that if it's the left tube which is okay, you may find that you're ovulating from the right side, and then left.
And can you help with the timing?
You can try and help with the timing by actually doing a scan. You can do a scan and then you see where the egg is going to be released from. If it's from the right side and the left one is the one which is okay, maybe just enjoy your sex. There's nothing else you can do. There is no way you can shift that egg from the right to the left. So you have to wait until the egg is coming actually from the left side. So blocked tube is another reason for infertility.
Endometriosis?
Endometriosis is actually one of the biggest problems, and it affects about 10 to 15% of the women who come to see us because of infertility. And they come because of something completely, about 10 to 15%. So it's a big percentage.
That's a big number.
Polycystic ovaries as well. That is also another problem. We have another issue with fibroids. And we know that women of African origin have about anywhere between 30 and 60% more fibroids than women of other races. And of course here the issue is we have more fibroids and they are bigger. A colleague of mine wrote a paper, and he said, mine is 140. What is yours? It's a very interesting title. What he was actually saying is that he had removed 140 fibroids from a woman. 140 fibroids from one person. 140. And how many? What are yours? Mine are, I think mine are 70 or 80 from one person. So yes, but I haven't got 140.
It's a whole business.
So that is another issue. Fibroids. We have issues with post-abortion complications. A lot of young ladies, and some even who are married, have children, they still go and have illegal abortions.
Sorry to cut you short, but another biggest myth is that you are infertile because you aborted.
That is wrong.
Yes.
That is not true. But I have to justify that. If you can have, somewhat, as I saying, post-abortion complications, you procure these abortion pregnancy legally, you go to people who have no idea what they're doing. Whatever they're doing actually leads to other complications. You may perforate the uterus.
So it is not the abortion per se.
How it is done, how it is done. We also have issues with the hormones. So you have what hormonal imbalance, where you have one of the hormones is elevated. For example, the thyroid hormone, and the thyroid gland is a very, very important gland which sits just in front of the voice box. And the hormones that it produces is like them call it the manager of other hormones. So if you have the thyroid the stimulating hormone which is elevated, or it's lower than what it's supposed to be, so first of all, the body will not be functioning the way it should, and this will affect the normal reproduction system. Sex, not having sex, it looks so simple.
We just assume that's true.
It looks so simple. It looks so simple.
Yes, there are those people. I watched another thing on YouTube. A couple that was saying they got married. They didn't know that when they go to honeymoon, what they're supposed to do, and they are wondering why children are not coming. So let us not assume
they are warming each other and they are not getting pregnant.
Why is the baby not coming?
There was no osmosis. A bit of osmosis.
Yes.
So that can be a challenge. There's a time we had our congress in Mombasa, and we screened around 700 women. What was telling you was that about 35% of the women that we saw, their husbands were actually working outside the country. So they would only come back home once a year for 3 weeks, 4 weeks. So in that 3 to 4 weeks, if the lady is not in the right phase, obviously she will not get. But sometimes they could actually even be living together. Remember we talked about libido at some time. So if that libido is not there, and then there's also men who also have a low sex drive. So for them to have sex once a month, they are okay.
That's enough.
And they are not. It's going to be very difficult for them to have.
And now that we are on the sex bit, I've watched the biggest struggle, the biggest psychological struggle when it comes to infertility and sex is when they feel the need to have sex at the specific time, so it has become a chore. It is a prescription.
And
it is tiring.
That becomes a burden.
Yes, it is a burden.
I had a couple some time ago where the husband said, "Okay," they said, "So what time should we come?" So I worked it out for them. I said, "You should come at this time. We do a scan, whatever." So we do the scan. They say, "Now we are ready." The guy is out of Nairobi, very serious business. Mama namwambia, "Come now."
Yes, and by the way,
daktari amesema
drop everything and come now. So the guy is stressed. Kwanza hawezi kupata flight, sijui nini.
Afike apate hata erectile dysfunction.
And by the time he comes, he's so stressed hata hawezi kufanya kitu.
The anxiety.
So it becomes a big burden. So that issue of timing ati kwamba sasa
kama sio sasa ni sasa.
And even when we are doing it is because it's a chore, it's a prescription. So we are not even relaxed. You are not even enjoying. You are just plasma.
So obviously it didn't work. So we had to look for other ways of trying to help them. Sometimes there can be all these factors, 2 or 3 factors combined at the same time. So you find there are blocked tubes and let's say hormonal imbalance, or let's say you have polycystic ovaries and something else, and so on.
And is it possible then to have I don't know how your experience has been. Is it possible to have a man when we check the sperms, everything is okay, the woman, everything is okay, but they're still not getting the child?
Yes. That accounts for about 5% of the cases of infertility, which is quote unquote unexplained infertility.
Okay.
But what my former boss in London used to say was to tell me that, Kireki, there's nothing like unexplained infertility.
There's something.
It means that there are maybe some tests which you haven't done. Because there are some very basic tests which you can do for everybody, but then there are others which I remember you asked, so is it possible that there are some men you can get pregnant with and not others.
You're patterned with this one, but in pattern with this one.
Everything can be okay, but sometimes in the vagina, during that period when you are ready ovulation time, there is a discharge that comes out, which is clear, mucus-like, slippery, and so on. That can have quote unquote soldiers against the sperm
and keeps
antibodies.
killing.
Yes. So when it gets there, when the sperm get there, these soldiers block the sperm from going.
They neutralize
it. Neutralize it completely.
Are there perhaps things within our environment, maybe the things we eat, the things we don't do, that could also be contributing to infertility cases?
Yeah. I mean, everything that doctor has explained, our endometriosis, PCOS, all these causes that we've talked about.
And that list is not exhaustive, by the way.
It's quite broad. If you look back and if you sit back now and look back and you realize that your lifestyle, the kind of lifestyle that you're living, has a major role to play in treating them, even as you treat them medically. Like, for example, we just talked about stress, the amount of stress levels. You have hormonal imbalance, you have endometriosis, you have all these things, but your environment is very toxic. You are under so much stress. Even the healing of that issue will be a problem itself. If you're obese, we need to work on the weight, because the obesity is hindering and causing so many other issues. So then it means that you have to check on your diet. If you are inactive physically, the blood flow is just dormant. Everything is
while
just
you're at it in that obese thing. Let me just maybe just like a small pointer. Africans, we like our ladies who are well endowed. Yeah. And once you get married, and just as has not put on weight, then you are not feeding him well.
You're not
feeding him well.
They even check what is wrong.
Hakuna kitambi.
Especially even for us women, when you get married and you have a petite
so
body.
it means kwani mzee anakufungia
there are those aunties who will ask, are you not eating? Are we not feeding you well? There are men who tell me it's a chore for me to have sex. So I tell them, shed off some weight. Yes, Also, a woman who is using a lot of cigarette, alcohol, drugs, they are interfering with the chemicals, as we have been talking about. So we do not want to say that you can just, you are smoking, you are drinking, you are eating wrong, you are obese, and then you go to doctor, we check and we say a problem. We say there's a problem, and then you don't want to go there 360 degrees. So yes, you must observe your life, the kind of lifestyle that you are living.
There are so many factors which I think we will spend time later on to look at each one of them: endometriosis, fibroids, and those kind of things.
Absolutely,
they all need their own, time to be able to look at them in depth. But for someone who is at that point where they have come to terms with the situation of infertility, what are some of the alternatives or solutions that one can be able to consider?
One, watch the show. Watch this show. Because you will realize you are not alone.
Yes.
Because the more you keep quiet, you keep it inside you, the more it will become a problem.
That is true.
So having this conversation is the first point. Number two, Dr. Ari said, own it. If this is what is happening, acknowledge, then go look for that help. Because there are people who are still fighting it. Maybe nilisikia mganga fulani or there's even a couple that came and told me that they were told it's a spiritual attack, so they need to be actually, she's actually a medical doctor.
I've had a spiritual attack. I've had kwamba mama amenifunga, mama mkwe alinifunga, sijui alifunga nini. So wengine wanaenda kanisani. In fact, one came and told me, Daktari, I just want to tell you the truth. I'm a very strong Christian. I'm actually in the praise and worship and whatever, one of those deacons, whatever in church. But nikitoka kanisani, ninaenda kwa mganga. Kwa maana sijapata mtoto. Yeah. Na unajua kwa mganga anatupa sijui nini chini, anaangalia anasema, you know that neighbor on your left, yule ndiye amekufunga.
Nilete jogoo ya black.
Whereas we know that actually this is a medical issue.
Yes.
It's a medical issue. We can actually pinpoint where the problem is and we can actually solve it. But what now they come in is the psychological aspect. They come and mix you psychologically.
And you think, but because you don't want to talk about it, or because maybe we have not made this conversation available, you think you're alone. Let me keep
Yes.
quiet. That's why you can leave church and go to mganga silently, quietly. I'm sure she doesn't broadcast.
Of course she will not.
So we are silent. It is a stigma. It's something that it is a personal issue. Number 3, let us create, now this is a societal responsibility. Let us create more platforms where we can talk about this without stigma. We cannot, I think we have, the 3 of us have agreed, and I'm sure even some of our audience will agree, that the biggest stigma comes from the church, from the women group, from the people just around you. So then why don't we as a society change that whole perspective? And then you take your lifestyle issues. What are you feeding on? You cannot be feeding on processed food Monday to Monday. You cannot be feeding on all the wrong things. You are not doing any workouts, and then you expect daktari to do a miracle for you. Then you must go and get checked to know, is it the problem? Where is the problem? What is the problem? And if you can, please, please, please go as a couple.
The ones who are going to get married, you're in a serious relationship, and you are looking at this young man or this young lady, and you're really looking forward to settling down with him or her. That one, of course, we can also do. We can do tests, simple tests for the man. It's very simple. We'll talk about it maybe later on. And for the lady, what we need to do, number 1, we need to take the history properly, a proper medical and surgical history. When her period started, how are her periods? Are they regular? Are they irregular? etc, etc. And then we send her for tests. And the basic tests are, number 1, to check whether the tubes are okay, what is called HSG. Not the most friendly tests, because it can be painful sometimes, but it is the gold standard, and it's what we have available. The other one that can be done is for us to take her to theater and do what is called a laparoscopy, diagnostic laparoscopy. More expensive, takes more time, and so on. So those 2 tests, that's what we can do. So to check the tubes. And then the second one is to check our hormone levels. Remember, we talked about TSH, that is from the thyroid gland. We can also check another hormone called prolactin. We can also check another one which is called AMH, which tells us about her ovarian reserve. So the higher the AMH, the higher the chances of getting pregnant, because you have a very good ovarian reserve. And then the last test that we want to do is we want to do a scan, a transvaginal scan, not a pelvic scan. Those are 2 different things, because the pelvic scan, you go and somebody will do it through the abdomen. It's not very accurate. But when you do a transvaginal scan, and again here, in order for us to do a transvaginal scan, then this lady should have had intercourse, because we don't want to traumatize her. The transvaginal scan is very accurate, because then we go right up to the womb, and we'll actually go right up to the ovaries, and we can see them very, very clearly, as opposed to when we do it through the abdomen, as it were. So those 3 tests will give us a very good idea about what is happening. All factors, being equal, where the problem is and how we can solve it. So those are some of the things.
I have a question that women ask, and even men.
Yes.
Does abuse or does use of family planning methods, especially at early age, cause infertility?
First of all, just the name itself, contraception. It's against getting pregnant. Okay, so the purpose of contraception is basically to stop the woman, stop the ovaries from working, so that she does not get pregnant. That is 1. 2, for her to space her children the way she wants. So she can use contraception for 2 years. She stops, she gets pregnant. Now, does it mean that using it from an early age will stop her from getting pregnant? No, it doesn't. And actually, there is data to suggest and to show that once this woman has stopped using contraception, the chances of even getting twins is even higher than normal. So I think it's a misconception which has been, been sold around, bandied around, that, if you're going to use this, then you're going to have, infertility in the future. That is not true.
Okay. Wow, it always feels so good to learn, to keep learning. Okay.
Let's end it here. But of course, we are saying that this is one subject that we are continually going to look into, and now address each of those segments and each of those things that we've identified as an issue that needs to be addressed as it relates to infertility. In women. On our next episode, we'll be looking at infertility in men. That's a huge one. Hardly talked about. Any final thoughts, Carol?
I'll just rubber stamp what we've just been saying here today. You are not alone. It's not the end of the world. And there is always something that can be done if you're willing and able and accepting to seek the help, and help is available. You can talk to daktari and go and get all these medical checkups, and then when you find what the issue is, you come to me. Let us look at the lifestyle issues and how we can work around both of them and make sure that everything is going to happen. However, I still think and believe that conception is more divine, very divine. So don't beat yourself so hard. Don't beat yourself so hard. You could have done everything, all the things we are talking about, and it didn't happen. It is very divine. Thank you very much. And
for those who would like to perhaps reach out.
Oh, yes. I work with a company called Rejuvenating Nature's Beam. My headquarters are in Thika Town, Section 9, just before you get to Chania Tourist Lodge. However, I'm also in Hurlingham, Titan Complex, Chaka Road, Meza 9. And then I have different shops in different parts of the world. And if you reach out with that phone number that is given, 0711 621563, 0711 621563, will be able to tell you who is near you and will be able to help you. I am a naturopathic health coach. And so we look at the natural resources around us and how we can leverage on them to prevent and manage diseases.
Very good. Yes, Daktari, your final words.
What I would like to tell our, guys who are watching this program is that infertility, we're talking about female infertility, is a challenge, yes, but it is not the end of the road. There are so many avenues that we can help you to get pregnant. But first and foremost, you need to come for us to, first of all, identify where the problem is. And once we've identified where the problem is, I can assure you we'll find a way of helping you to get a baby. My office, I'm located at 5th Avenue, Ngong Road. And they're on the 3rd floor, office number 314. The phone number to the office to make an appointment is 0780 170 170. Very easy to remember.
Very easy.
780 170 170.
Very good.
Thank you.
It's always a pleasure.
I have something else I would like to tell the ladies
Carol.
and the gentlemen who are watching. Please stop asking people when they are giving birth. It taps them. It's okay. Just stop asking. If you feel pressed, don't ask. Yes.
And those who ask have no investment in the
Yes,
relationships.
Just don't ask.
Once I give birth, you don't contribute to raising these children.
Yeah.
What's your interest?
We need to change that.
Oh, man. Thank you so much, Daktari. Thank you, Caro. It's always a pleasure having both of you around.
Yes.
And you make the show what it is. I'm looking forward always to the next episode and conversation. As we come to the close of this particular episode, I want to thank you and pray that God keeping us. We see you again on the next one where we talk about infertility in men. I'm your host, Justus. Thank you for watching. See you again next time.